Hmm. Hi, welcome to Not Medical Advice. I'm Daryl Becker, and these are medical stories to showcase the effective medical options you haven't heard of or never seriously considered. Just like the title of the show, this video and podcast is not intended to be used as medical advice, and there is no claim that anything that me or my guests mention can be used to diagnose, treat, cure, or prevent any disease or injury. You are responsible for what happens if you use information in this show to treat any medical condition, and I am not responsible for anything that you choose to do. And if you have a medical condition, you can find an effective professional to help you. I'm here right now with Dr. Melissa Sell over there in California, and I'm really grateful to have you here. Would you please go ahead and give yourself some of an intro to tell me of exactly what kind of chiropractor are you? What do you do?
Well, I'm a chiropractor. I graduated chiropractic school in 2012, and I worked in active practice for about 5 years right after school. And I specialized in everything holistic health. So nutrition, exercise, detoxification. I taught seminars and workshops and worked with structural correction of the spine. And I love that work. I loved it. That was what I was obsessed with since the time I got out of high school, was helping people to change their lifestyle and to become healthy. And after a while of being in chiropractic practice, I started noticing that some of the, because the behavioral prescriptions that I give people, eat this, don't eat that, do this exercise, don't do that, giving all of this lifestyle advice. And some of it would stick with some people, others would try it and then fall off the wagon and then get back on. I just started noticing patterns within people and started seeing that people weren't always getting the level of results that I had envisioned for them or that I wanted for them. And I started seeing that, there was more to it than just behavioral prescriptions. And that's when I got really interested in the mind. And I started doing a lot of inner work on myself, despite doing all of the healthy lifestyle, everything. I was like, the picture of physical health, I still had like Sunday night anxiety. I was always, kind of had this background like worry, and, I was raised in a home full of worry. So I, was just constantly kind of worried about everything, not getting great results in my relationships, causing fights and things like that. And so I started going down the road of personal growth, meditation, just understanding the inner workings of the mind and perception and how we create our own reality based on what we think, feel, and believe. And so I got really, really interested in that. My partner and I, we started going hard into the direction of like, maybe we need to help people with what's going on behind their eyes rather than just what they're doing, what they're eating. And so we got really interested in that. And then along that journey, I discovered Germanic new medicine. And so that was just a bombshell of, oh my goodness, this work showed me the direct relationship between perception and physical health, which I'm sure we'll talk a little bit more about later. But yeah, so currently I do all virtual practice, and I work with people and helping them to understand and make the connections between, what's going on with their physical health and then what's going on with their mental and emotional health, the bridges between the two, and how to create a state of inner peace, of balance, so that your body is getting the message that you are safe and that it's safe to heal, and that, you can restore homeostasis by shifting what's going on with you mentally and emotionally.
Let's jump right into Germanic new medicine, actually. Please, since I'll tell you, my audience is not at all familiar with this, I know for sure. So just
Okay.
start from the beginning and go wherever you want to go on that
Okay,
one.
awesome. Yeah, so for me, I was like, what is this? I heard about it on a random podcast. I was like looking up stuff about magnesium supplementation, and the lady mentioned it. And I was like, I've never looked into this. And so it's the work of a German medical doctor who in the late 70s, he had a personal tragedy. His 17-year-old son was killed. And a few months after his son's death, Dr. Hammer noticed he had developed testicular cancer. And so, he was a very bright medical doctor. He had invented some type of scalpel. So he was just very kind of forward thinking. And so this connection to him, he's like, there's got to be some kind of link between the loss of my son and me developing testicular cancer. And he was the heading up an oncology unit and began, I believe, interviewing people and seeing, did you have some type of shocking emotional trauma prior to, in the years or months prior to the development of your cancer? And he found that in every case, it was yes. Yes, there was some type of shocking trauma that occurred. But beyond that, because, a lot of people, like the whole mind-body connection, stress-causing disease, psychosomatics has been around for, years before, Dr. Hammer's work. But he took this hypothesis, this idea, further than anybody ever has. And he studied it in greater detail than anybody ever has. I believe there's like 40,000 CT scans of the brains of people, because what he discovered was 5 biological laws of nature. He discovered the connection between the psyche, the brain, and the organ. And he found that cancers are not just random. So like, why does one person develop colon cancer and another develops breast cancer and another testicular cancer? Is that just like random luck of the draw? And he found that absolutely not. It is very specific and biologically programmed into the organism, and that cancer is not a disease. It's not something going wrong in the body. And most of the things that we think of as disease, as oh, my body's just breaking down, or I have a bad gene, or I was exposed to a pathogen and it's causing disease in my body. What he discovered was that our body has innate mechanisms of adaptation. And when we experience a specific type of conflict shock, or it's called the Dirkhammer syndrome, this DHS, this is a shocking trauma that catches you off guard. So you are beyond your ability to kind of mentally and emotionally respond to this thing. So your biology kicks in, and your biology now begins adapting specific tissues to help you to get out of this shocking situation. And they're all intended for increased survival or reproduction, because your body is built, designed, has this inborn ability to survive. And it wants to survive more than anything. It wants to survive and reproduce. And so whenever your body is making some kind of tissue adaptation or tissue change, and it can seem like, oh, my body is attacking me. The idea of autoimmune disease is that the body just randomly starts attacking itself. It's a very destructive idea. And when you understand things from this perspective of the 5 biological laws, and you start to see, if we had like a timeline of everything that's ever happened to you, even from the time that you were in the womb, your health would make perfect sense to you. If you could see that, if you could see all of the traumas, all of the little shocks, all of the things that have caught you off guard, if you had a map of that and you looked at the symptoms that you developed and the different health conditions, you would see, oh my goodness, this actually is not random. My body is not broken. This all makes very perfect logical sense when viewed from the biological context.
I love this context so far. And I'm really grateful that you actually introduced it to me, since I knew of pleomorphic theory from Underline, and I guess other interesting theories. I guess this would tie into my next question about the germ theory of disease, and basically comparing that one to terrain theory. Would you be open to talking about that one too?
Yeah. So the germ theory is that, the idea that there are germs, bacteria, and particles outside of us that get into the body and cause sickness. And so, this theory was put forth by Pasteur back in the day, but it wasn't the only theory that was around at the time. There were other teachers that were talking about the terrain, that it doesn't actually seem consistent. And even in the studies that were done, they would take like mucus, and so they take a sick person and they gather up all the fluids and gross stuff coming off that person's body, and they would try to make healthy people sick using these fluids, and it doesn't consistently work. even in the studies that have been done, trying to make a sick person or a healthy person sick based off of the remnants of what's coming off of the sick person. And so that hasn't even been established. But most people, once you get an idea in your mind and once something catches on, like in the popular culture, it becomes very difficult to kind of shake that theory unless you start having personal experiential reference points for, I was around a bunch of sick people, but I didn't get sick. If it was just a germ, if the germ was all that mattered, everyone would have to get sick every time.
Now, I
Period.
went through medical training also, like multiple times actually. And it was many, many classes for me just to get to my acupuncture license. Many classes that I would have to say, leaned really, really hard and heavy on the germ theory of disease. And there were a few moments where, like at least a few classes that were incredibly questioning of, the origins of the American Medical Association and what was happening about 100 some years ago, when there were multiple guilds of medical skills that were being developed at that time, about a century ago, and a little bit even before that, like turn of the century. I wondered, how does it compare for you? Like when you went through medical college, did it seem rather slanted in the direction of germ theory, or what was it like for you?
Yeah, the first half of chiropractic school, I think, is pretty much, identical as far as the courses you take in medical school. So it's all the ologies, pathology, physiology, but, and especially the pathology classes, and the microbiology classes, there was just no question in those teachers' minds that it was the germ theory. But I before even going to school, the thing that I love about chiropractic is it's very rooted in philosophy. The developers of chiropractic they developed this very rich philosophy, all based around innate intelligence and about how, even chiropractic itself, the whole purpose of it is to better suit the body to the environment, to make the body stronger and more resilient. When I was working, because I worked in a chiropractic office as an assistant before I went to chiropractic school. And that's where my mind was really formed. And I started seeing, it's not germs. It's the host. It's the terrain. It's the strength of the, at that time I believed it was the strength of the immune system of the individual. My thoughts on that are a little different now with the GNM approach, but it was that I am in control. These germs aren't in control. I remember the chiropractor that I worked for, absolutely loved her, like one of the very best role models of my life. I remember one time, people who would come into the office, people would, be on the phone and say, oh, well, I'm sick. I can't come in. And the doctor, she goes, I would kiss you on the mouth. That I would not get sick. Even if you came into this office and you were sick, I would not get sick, because she had this this bold belief in her immune system and her ability to not get sick, even if someone around her was sick. So we had encouraged sick people to come into the office all the time. We weren't scared about them spreading germs, because you're there to, get adjusted, which is, meant to boost your immune system and make you stronger and make your body heal more rapidly. And so that for me, even before I went to chiropractic school. And so I kind of took all of the pathology and all of the germ theory leaning courses with a grain of salt, because I knew that those people, they're in a model, they're teaching based on what they know, and they haven't invited themselves outside of that realm to see it from a different perspective. Actually, a couple of the teachers were very kind of hardcore, very into the germ theory, and I took the classes, but they didn't really affect me.
Your experience mirrors a lot of what I went through, and basically like that. The I think that the process of going through medical college of any kind, or any type of higher level thing, for me it was a master's degree. For you it was a doctorate. It's there's actually a book on this subject called Disciplined Minds, written by Jeff Schmidt. I highly recommend it. It actually shows how the process that you and I and our colleagues went through to get to their medical license was a very effective way to traumatize us and others, so that only the most conformist and obedient would actually be able to go through the board exams, for example, which of course I passed and you passed. were largely data points to show how obedient we would be able to answer mostly trick questions to see how clever we are, you know, with like A, B, C, and D, and in this case, C and D being extremely similar with like a small nuance that we have to catch. That is just, again, about obedience and training and conformity training. And I saw that written large on the professors going through college for sure. They were affected by that. So yeah, I'm aware of that, but I am glad though that being in holistic healthcare is that is what chiropractic and acupuncture is. If you've looked up either of our professions on Wikipedia, which I find is very educational to see what are our professions lumped in with, you know, and in terms of what's called pseudoscience and pseudomedicine, like that in that genre. And yet, of course, at the same time, humongous insurance companies will put out oodles of money towards both of our professions for, you know, like literally they know what is effective because they're paying for it. They're paying money. So there's an interesting double standard in terms of when people are pointing towards science with Wikipedia. But on the other hand, you know, the folks with the lots of money, and those are insurance companies, they invest only in things that actually give results, you know, and they don't invest in things that don't, but more and more, with the exception, of course, of mainstream medicine in terms of iatrogenic disease or doctor-caused illness, which is a humongous portion of my practice personally. Meaning like they hurt them and portion of that funnels in, and that's what I get to work on. Is that a portion of your clientele too? Iatrogenic
Well,
disease or?
well, yeah, people, especially when you're understanding that it's trauma and it's fear that is driving adaptations within the body. I mean, medicine does nothing but traumatize people, in my opinion. I mean, the like people that I work with that have upcoming scans, like if they've had a diagnosis in the past and they have to go back on a frequent basis, like the fear that ramps up prior to that appointment, and the panic and the, oh, is it going to be a bad result, oh, what if my numbers are this, like that fear in and of itself. So that, you know, in that realm of, you know, iatrogenic induced illness, yes, I have to help people break through that mentality and to look at, you know, going for a scan as just gathering data, and every, you know, every piece of information that you gather, nothing's good, nothing's bad. It's just, okay, let's see what are we working with, because they are indicators, they're parameters of the state of adaptation of your body. But the thing is the way that the medical profession interprets certain symptoms, certain numbers, blood levels, hormone, whatever, when they view it inside of their box, they say, oh, there's something wrong with you. But if you view it from this greater picture, when you look at it as an adaptive mechanism, you can see, oh, actually what you are experiencing as discomfort, as, oh my gosh, it feels like something's really wrong. In many cases, that's an indication of the healing phase, and how you react and respond to those symptoms is going to determine whether you reactivate a conflict or if you persist on through the healing phase. And so there's a lot of re-education, and trying to uncouple things like pain means something's wrong with me, because from the Germany medicine perspective, in the second biological law, you'll see that pain and swelling and discomfort, and the times when you most feel like I am sick, there's something wrong with me right now, actually is when your body is in the repair mode, that you had been in conflict for a while and your tissues were adapting and you were stressed and worried and not sleeping. Then you resolve the conflict and your body has shifted into this state of regeneration and tissue repair. And that's when you're like out, you know, you're fatigued and you have all these symptoms and you're feverish and, you know, or you're coughing. Typically all the symptoms happen during that healing phase. And if you don't recognize it as healing, you think there's something wrong with you. And this can put you in this vicious cycle where you're responding to the symptoms. You say there's something wrong with me, which can initiate a new conflict. And so there's a lot of just changing how you perceive symptoms. And so, yes, when dealing with the medical profession and people who are, you know, because typically people I work with, you know, they utilize everything. I recommend, because if you do believe that you would be, you know, neglecting yourself by not going the medical route, which is a lot of, a lot of people are stuck in this, one foot in each camp. They've got their family who wants them to do all the medical treatment because they're scared and they believe, they're out of this fear. It's like, well, of course you're going to go to the medical doctor. Of course you're going to do whatever treatment they want you to do. And then they've got their foot in like the holistic world and they're like, that doesn't make sense to me. And I believe it's actually going to hurt me and be worse. But then they've got their family who really want them to do this. Obviously the medical doctors really want them to pursue the treatment. And so a lot of my work is in helping that individual to make sense out of their choices, about the extent to which they utilize medical care, how they view it, how they feel about it as they're doing it, because it's that split energy. That's that is conflictive, and that's what can contribute to more adaptations. And so I try just to help a person to get all on board with whatever they're doing, to find peace with whatever it is that their course of action. And that's what's going to help them to, to survive and make it through this, intense situation that they happen to be going through at this moment.
There obviously is a lot of current event stuff that I was hoping to touch on. I was more and more getting into looking at what are exosomes and what is a virus and what is known about viruses so far. And that's why I gave you a little time to prepare on this one. But so far as I could tell, it seemed like exosomes are packages of toxic material that is basically kept away from the cells, like around the cells, that they're very small, virus size, basically, really, really small, and are often being photographed and used in place of a virus, or to claim that that is a virus. And that's some of what I'm seeing so far. And of course, I will get people decrying that is not at all true, and that this is a conspiracy theory kind of angle to look at. But I find that actually that exosome data is really important, because I think it's not that old. I mean, it goes back to the late 80s, as far as I can tell. Do you have any thoughts on this one?
Well, yeah. I'd like to just, I guess, present from the German new medicine perspective, Dr. Hammer, the fourth biological law. It's called the ontogenetic system of microbes. And so this is the recognition that our bodies are integrated fully with microbes. People know about the microbiome. There's actually something called the microbiome, and that there are, viruses, bacteria, fungus, embedded into our bodies. They if you couldn't survive without them. So in a very real sense, they are you. They are life. They are a part of you. We see them as other. We see them as this is the bacteria and this is me. But when you look at it from this more holistic perspective, you are you are the bugs. You are the bacteria. It is you. It is part of this whole vitalistic thing called life. And Dr. Hammer discovered that bacteria and fungus and viruses, he always said, if they exist, they serve a function. They serve a vital function in healing. And something just amazing. So just kind of briefly about bacteria, something like tubercular bacteria is functional within the body. So if someone has a tubercular infection, what that indicates is that person experienced a death fright conflict. And so when you have a death fright conflict, this is something shocking. You're in a bank and there's a bank robber and he's got a gun and you're scared for your life. That conflict, that scary situation may induce in you a death fright conflict, which causes a proliferation of your lung alveoli. And so proliferation, what is that? That's extra cells. That's extra cells growing in your body. People think extra cells, we think of cancer, we think of this bad thing happening, but it's not that there's something wrong happening. It's that your body deliberately, in response to your perception of a situation, proliferates additional cells to help you to survive. So you have more alveoli, you can absorb more oxygen, and you can, more quickly get out of this situation. Then once you resolve the conflict, once you're safe, now your body has these extra cells in your lungs, and the body says, okay, now it's time to clean that up. And it uses bacteria, like tubercular bacteria. What it does is it decomposes the additional cells that are no longer needed. And so bacteria in the body, they serve this very functional, like just like they serve in nature, they break down no longer needed tissue, dead tissue. And so viruses, you typically will find viruses in certain areas of the body. It's not everywhere, it's certain types of tissue. And Dr. Hammer found that it's cortex controlled tissues. So you'll see this like the bronchial lining controlled by the cortex. A virus is associated with like cervical cancer. They say, oh, HPV. So here it's believed that the virus causes the thing called cervical cancer, or what's another example of a virus? Anyway, so we have this idea of this virus, this particle that gets in the body, even though it's not living. We know that it's not living. We know that it's not like it doesn't have. We have this idea in our mind that it has like a nefarious motive, that it's just out there floating around and it passes from person to person and then it gets inside of you. And the whole idea that Dr. Hammer says is like, no, it's there, it's serving some type of role in the healing process, because you find it at sites of healing, typically, sites where there's symptoms. And like you were saying about the exosome, so they've done electron microscope pictures of, so if a person's got a cough, they get some fluid out of there, they try or attempt to, or hopefully they do isolate something that they consider this virus. But the thing is what they're isolating, it's protein particles. It's like RNA. It's these particles within the body. And we're taking this snapshot and we're saying, oh, this is the causative agent. This right here, this that we have a still shot picture of, not like an in vivo, like we're actually watching it and what it's doing in the body. We're taking a picture of something and we are saying, aha, this is the culprit. And we build this whole system of, quote, science around the idea that it's this little particle that's causing this problem. And the thing that Dr. Hammer's saying is, no, it's coming from the body itself. And so that kind of goes back to that, the pleomorphism, is that the body has the ability to generate bacteria and to generate things called viruses. But with the exosome theory and this exosome connection that, a bunch of scientists are out there making right now, is that the snapshot that we've taken of this thing that we've labeled as a virus is identical to some other analogous thing that probably is the exact same thing, which are these exosomes, which are created in the body in response to what? Toxic exposure, to stress. So inside the endosomal compartment of a cell, we've got all of these little, organelles, all these little vesicles, all of these amazing structures that serve biological functions. And just even think about a cell and all of the, what is it? I think I've read somewhere, and this is obviously an estimate because who really knows, like 100,000 different like reactions taking place in a single cell. And then think of all of the trillions of cells that make up your body. I find, and I guess that, that's one of the things about just kind of conventional medicine that's just so, I feel, antiquated, is just like, and arrogant, is that you think that you know what's going on in this entire body based on single snapshots, based on a few hypotheses. I don't think that they leave enough room for that. We don't really know what the hell is going on here. And if there was a little more humility and a little more willingness to have been wrong about something and to have gotten it completely wrong, that we'd have a lot more advances in medicine if people would recognize that, like, we don't know everything, but now, oh my goodness, exosomes, oh, you mean the body is actually making this in response to some type of traumatic either event or some type of toxic insult, and the body is producing this exosome that cleans things up, and it does tissue helps in wound repair and tissue communication from cell to cell. And I believe that that's really what's going on, is that it's not an agent from outside getting in, causing problems. It's you had some type of conflict, some type of shock, maybe toxic insult, and your body has produced this thing called an exosome as part of the cleanup process.
I think we'll get back to exosomes in a moment, but I wanted to just go back to Koch's postulate right there, which I think was really important because around the time of Pasteur, who was, basically the one to make germ theory very popular, uh, there was Robert Koch, who came up with his four-part postulate right there, which anyone could go on Wikipedia, KOCH postulate, KOCH apostrophe S postulates, and that would pretty much show you what we're talking about, where an organism would need to be found in a sick individual, like somewhere in the tissues, and then that organism needs to be cultured on its own and then purified, meaning like that all extracellular material is removed, and now you're just growing the pathogen, just the pathogen on a completely clean, sterile medium. And now this cultured medium is now like this organism is now needs to be introduced into, in this instance, ethically an animal study, or unethically Nazi style that would be a human. And then the same disease would need to be seen, like to actually manifest in this new organism, probably an animal. And then the last part, once again, you need to go culture that organism out of this, or like where the animal that it was grown in, that was developing the same symptoms as the human, and now once again isolated, or as some would call it, purified, like meaning we just want the organism, just to like prove it once again. So my question, did I sum up Koch's postulate pretty much?
That was perfect. Yes, I'm looking at them right now. Those
So
are
you're
spot on.
reading along. I'm not. I'm just doing it from my head, but I prepared a little bit. So basically, that's a really important one. And my question is, have you seen the evidence showing that Koch's postulate has ever been proven for any bacteria, virus, or fungus infection at all?
Not in my research. No, and if it's out there, please send it to me.
And me too. I want it,
Especially, and that's the thing, is like, when you, given what's going on right now, the fact that this scientific standard has not been met for something that has, caused as big of an upset to the globe as this has, you would think that you would be triple checking and making sure, okay, is this for sure what's happening? Are we absolutely certain that this is the case? And so if that doesn't raise some eyebrows and raise some red flags for you, of like, oh, you mean, and I think that probably the average person would assume that all the gold standards are being met. You would assume that, of course, you wouldn't be telling everyone that this was happening if you didn't have the most sound science behind it. But that's where, I think that the average person may be a little too credulous regarding what they hear on the news, and that if you dig a little bit, you may find things that would very much shock you and surprise you, that certain standards are not being met.
Right. I mean, I'm finding it that the there is this certain quote: it's very difficult to explain something to someone and have them understand it if their salary depends upon them not understanding it. So the credentialed medical professionals who I have asked about this question, has any virus ever passed Koch's postulate ever so far? And one of the answers I've gotten is viruses can't pass Koch's postulate because they don't need to. It's just known that they cause the illness, but they can't be cultured, and that's why it doesn't pass it. And I found that very interesting, that they cannot be cultured, and that still there's a lot of that. But that's going into the people who are credentialed. If you're as a financial salary, there are emotional salaries that I would wish to bring up. An emotional salary is your family, your friends, your folks at work, the people that you're connected to all have this belief that germ theory was proven more than 100 years ago, and that's why the milk is being pasteurized. And based on the work of Louis Pasteur, and that's that it passed like that way. It has to be done like that. And people are crazy for drinking raw milk and other claims like that. And essentially, yeah, I kind of kicked myself for actually clinging to the last remnants of germ theory for the last part of my practice, actually. But I am open to any viewers, that's you out there, to please go ahead and leave in the comments any links to papers that prove Koch's postulate on any bacteria, virus, or I would say like yeast, fungus kind of condition. That would be the main thing. Now, parasites, there's a different realm because that I think they are eggs that can hatch and they can grow. And I think it's possible if they were introduced into a healthy body that it's possible that they might not be destroyed, but in general, I think a healthy body would do a job to try to destroy them. Although I find that there's a high number of people that I find certain types of testing can show potential parasite infection. But that's just one little tip of like the iceberg. I mean, there's a lot more going on here. I guess, what do you think is going on regarding this COVID-19 situation, regarding the reverse transcription polymerase chain reaction, or RT-PCR tests, and anything that you wanted to say regarding testing, regarding the stats of the numbers, or what you think is really going on?
Well, my understanding is that the testing is highly inaccurate and that it can have up to an 80% false positive, so that you can be testing people and saying, yes, they're positive, but they're not actually positive because the tests are really sketchy. And then there's just the numbers of, are there really that many people getting sick? I saw some, I wish I could, I'll try to find it, a number of like the overall deaths on average for this time of year compared to like the previous 5 years. And the number of deaths is actually lower than just the average standard number. I mean, people die. I don't know if this is news to anyone, but people die every single year. People, and to blow something up like this and to scare people, and that's for me, as far as what I believe is really going on, is that there's this fear, especially with lung type conditions affecting the bronchial lining, that a fear fright, a territorial fear, can cause adaptation within the lungs. And so if something happened, and, kind of tracing this back, one of my colleagues did a great article where she kind of looked at what was going on in Wuhan, China, because this is where this whole thing allegedly started, and a bunch of people, developed these symptoms, and then some scientists said, oh, look, we've discovered a new virus. What was going on? That's the thing, is I am very uninterested in statistics. Personally, I am very interested in individuals, you can tell me all of these numbers, but until I've talked to people who actually are experiencing symptoms, you just don't know. And so that's, I think, one of the big problems with medicine as well, is just we give all of these numbers and all of these statistics, but it's what's going on with the individual? What happened to them? What did they go through? What did they mentally and emotionally experience? You don't get that from a number. And so, a bunch of people in this city, one of the things that potentially could have been initiated a territorial fear conflict was, I guess they were putting in some kind of new incinerator in the city, and a bunch of people had been protesting it because the air in that region already isn't good. Another incinerator, what is that? That's the safety of your children. The air that they're breathing in, can induce this kind of territorial fear that, if a bunch of people resolve this conflict all at once, they all develop symptoms, and during that repair process, sure, might there be something that can be swabbed and looked at under a microscope and say, oh, this is a virus. And then we build it and we hype it up and we put it in the news and we say, oh my goodness. And we put all this, these scary ideas of people being on ventilators and not being able to breathe. And we put that fear out there into, the consciousness of the group. And so other people develop this fear, and we say, oh, well, these people came from China and then they went to Italy, and then we get a bunch of people there. There's no way to calculate the impact of group fear and the impact of the terrifying idea of all of these people who believe in germ theory, that there is a little micro something that can get on them and make them sick. What is that? That's a fear for your territory. And so a person, some people are more susceptible to fears like that. Some people are more susceptible to groupthink and group fear and kind of that herd mentality. Others are less susceptible to it, because that's the thing too. Not everybody gets sick. explain that to me. Why, if some people get sick and some people do not, study the healthy. Like, what's different about the healthy people? Why are they not getting sick and these people are? And I think that there's just so much more to look into, so whether this testing seems inaccurate, to me, this all screams of ulterior motive, an alternate agenda. And I mean, that whole Event 201, where they've like laid out this whole model for how this whole pandemic and potential lockdown, it's like they have this model in mind, and then they are now trying it out on the actual public. And I think the people who are awake are like, this is stupid. We've never, ever, ever in the history of this country shut down everything over something that seems like pretty much equal to just the regular flu. Doesn't seem to be actually killing more people. I think they're trumping up the numbers. Insane things are happening with the way that they're reporting the statistics. Like, anybody who's dying of anything now is dying of this. That is bad science. Anyone with 2 brain cells should be able to see that's not okay. You can't say that that this virus caused that person to die. Prove it. This person had already was dying of something else and they die. You can't just label it COVID-19 and expect me to believe that just so you can trump up the numbers and induce more fear. So for me, I think it's all gobbledygook. I don't know what the end game is. It does seem like forced vaccination seems to be a thing. All of these governors saying we can't, meet in groups or have baseball games again until everybody's vaccinated. That to me is just like, hold the phone. That's your game? That seems like the game to me.
We covered the first of the 3 T's that I was hoping to touch on, testing. And there does seem to be a humongous lack of questioning of the tests. I think that viewers for this channel and also definitely go to YouTube, Dr. Melissa Sell, and check out her channel too. But go out there and look up Kary Mullis, Karymullis. That's the inventor of the PCR test that I just mentioned that we were briefly speaking about. And what did he have to write about it? What did he have to say about it on video and in various podcasts? Because he actually said plenty about it, and he died just last year. And I think that it's very important to understand what did the Nobel Prize winner, he won the Nobel Prize for inventing the PCR test. And then he decried it because it's basically polymerase chain reaction. It's basically an RNA DNA amplifier. It makes more RNA and DNA material. That's what it's designed to do. It replicates it. Like if you were in a I love the analogy, if it was a stadium and Melissa's out there with a yellow hat on, it would be like looking around for yellow hats, but then in this instance, it would be replicating yellow hats like crazy, like that. And to say, lo and behold, see, and there's your 80% false positive, because it just literally like it's putting yellow hats on a bunch of people that aren't Melissa in that instance, in a stadium of 80,000. Okay, maybe that's a crappy analogy, but either way, the 80% false positive is enough to make you scratch your head and say, I would like to know if that's true or not. It's very fascinating when I ask people, would you buy a car that 80% of the time does not work? And they would say no. Would you trust a test that scientists in white coats are all using if there was evidence showing that it was 80% false positive? And the 3 F's show up, emotionally speaking, since we both deal with the emotional component of our clientele and our persons that we interact with, is the fight, flight, and freeze. And in this instance, I do see a lot of freeze and flight, meaning like, I'm just going to change the subject, or freeze. I have nothing to say, no words to say about 80% false positive. There's a very low amount of curiosity to investigate, a very low amount of humility to acknowledge that maybe you backed the wrong horse in this race. And certainly a diminished amount of flexibility to consider these various angles, such as Germanic New Medicine, such as terrain theory. The second T is treatment. Okay. So what people are actually dying of, like both of us would be equipped to look at a chart and look at, say, well, what are the metrics being used to diagnose, and what exactly were the treatments? And what was the impact of the treatments? This is the second T in the three T's that I plan to cover. Have you looked at some of the treatments for COVID-19, for example?
I actually haven't looked too much into it. I did try to find, like, when a person dies allegedly of COVID-19, what are they actually dying of? And pneumonia seem to be one of the causes, and so that's when, you know, you've got fluid in the lungs, and it makes it very difficult to breathe, you know. But then I have seen lately a few reports or studies of just the danger of ventilators, and how, you know, normal breathing works off negative pressure, but the ventilator like forces air into, and it actually can be a cause of death, you know. And so we cannot underestimate the iatrogenic induced death, like due to the actual treatments that people are getting in the hospital setting. You know, being in a hospital setting, from the point of the view of the five biological laws, when you're in this panicked setting, and, you know, and everyone is really concerned, and you're scared, and you've got these symptoms, that can cause water retention. And when your body retains water, the water goes to the site of healing. And so if your lungs are already in healing, and you're coughing and your lungs start retaining water, that can very easily turn a bronchitis or a lung upper respiratory condition into pneumonia, because you're retaining all this water. And so that's, like, for me, the biggest thing is remaining calm and not inducing additional panic. But, you know, in the hospital setting, it's nothing but panic and medications and beeping, you know, machines and all sorts of very scary things. And so I'm not certain what exactly is the cause of death in every one of these cases. You can't just say it's the infection, because an infection in and of itself is not a cause of death. And so I don't know, have you read much about what they are reporting as the official causes of death in these cases?
I don't have access to really any real charting, like
Mm,
any real charting. All I hear is people said, I know someone who died of it. And they never say what were they exactly, what was the diagnosis method and what was the treatment method. There seems to be, as I said, a very low curiosity level and very low humility level in terms of investigating. They want to be right more than they have a passion, like I would presume you and I have a passion to find out what is right, and where could I be getting it wrong. Uh,
mhm.
I, I, in general, though, having looked at antiviral medicines for a long time since I was aware of the so-called AIDS epidemic, and I'll have to say so-called because it's one of these types of situations. I mean, that's where Carrie Mullis came onto my radar. That's where PCR tests came onto my radar about 20 years ago. That's like my first time I've started. Like I started my medical training in 1998, so it's kind of been a little bit of time for me to look into this, and it does seem like they are incredibly toxic medicines. Every one of the antivirals are very, very toxic. But more recently, antiviral medicines have changed. Some of the first ones, like AZT, which was one of the first, I believe it was the first drug to be promoted as to treat these HIV infected individuals who had AIDS symptoms. That medicine was built in the 70s, AZT. That's an antiviral medicine. And it was deemed at that time too toxic to be used for chemotherapy. They designed it for chemotherapy, but it was deemed too toxic to be used for chemotherapy and was shelved for approximately 10 years. And then when this came out, they brought it right out. And of course, like anything, when there's a pandemic, as that was announced in 83, I'm thinking this is the time when you were like maybe born. Um, you
Not
know,
quite.
possible, not quite born yet. But I was a teenager writing a paper for health class proclaiming how awesome it was that AZT was released for people to treat this. That was a little thing that I had to do for health class at that time in junior
Wow.
high. And it would be another, I would say, like 10 years after that, where I realized, oh, that was awful. But luckily, I mean, no one really cared because it was just a little boy writing a paper on a newspaper article. Um, I mean, because, you know, I really, that's where I was at right at that time. There, yeah, nevirapine was the next one, and there was all these other incredibly toxic medicines. What happened, as far as I can tell, because I do have a few HIV positive type clients who come in. Again, I would question their testing methods again, but they believe it fully. They're in that fearscape of, they have to believe. They can't imagine that they could have backed the wrong horse and they got bad info. The medicines they treat HIV clients nowadays is far less toxic than the AZT, nevirapine, and others. Whatever they're using right now for COVID, it's suspicious. I would have a huge suspicion for, just in case, because if it was anything that was fast tracked, kind of like the way AZT and nevirapine was, it would potentially, like, looking at the numbers, I wouldn't be surprised if it was a humongous portion of people who take them die. The ventilator one I did look into. 70% of people put on a ventilator die, and the remaining are damaged for life, meaning breathing problems for life because of this damage. Repairing damage, which is part of what I get to do in my practice. Like, I'm hands-on trying to help the body to fully reshape and like repair damage that, like, on all kinds of levels, including this. um it does seem pretty profound, because at a certain point, like growing a bunion, or having parts of your vocal cords cut out, or portions of intestines cut out, i'm not um I'm not yet at that point in my practice where I know how to regenerate tissue and organ to that level. So I would say that there's caution for anyone watching, just to say, what if the treatments themselves were, as I'm proposing, very, very dangerous and damaging? And also, I mean, there's an article out there I recommend every medical provider to ever look up: Death by Medicine, Gary Null, one of the authors. I guess you know that one. Yeah, so that's cool. This is so cool that youngins like this stuff. You know, yeah, that kind of stuff is really neat, because we're talking like 250, 300,000 Americans just in America dying from the treatments. Oh, yeah, from actual following what they're supposed to do for taking a prescription, from following like what they're supposed to do for a diagnostic test that killed them, or an actual medicine that killed them, or a treatment or of any kind that killed them. That's a lot of people dying. That would, I would say that that part has been a humongous number, like way more than COVID deaths is death by medicine. And these are methods that cannot be claimed. You can't say that this is malpractice. They were following the rules. So all of those doctors who prescribed these things or administered these treatments, they're covered. They are not, you cannot sue them for any damages, just like the same thing for a vaccine. Court protects the vaccine manufacturers or any doctor who administers them. They are fully covered, and they will never go to any, they will never receive any, I would say, any type of punishment, not that that helps, or do restitution for those that they actually hurt and killed. So that's my take on treatment. Just wanted to give my opinions on that. You had any further thoughts?
Well, I was thinking just about the fact that, like, people aren't going to, well, one, people aren't going out, and people aren't being, injured or having, typical things that you might go into the ER, end up in the hospital or doctor's office for. I actually think that once this is all said and done, the death rates, and you probably are familiar with some of these numbers, what was it, like in Israel or something, where the doctors went on strike and the death rate just like went way, way down. I kind of feel like that's going to happen because of the fact that people aren't going into the doctors, and we're trying to keep the, the hospitals clear for the COVID people. I think that there's going to be less death when this is all said and done, less reports of SIDS, like if kids aren't going to their normal checkups and getting, their normal vaccinations and all of that. I think that it's actually going to net be better for public health that people are not going out, or maybe not going to the doctors and the hospitals like they normally would, because of those numbers that you, from the death by medicine report, and knowing that, iatrogenesis, like, people just don't realize that, what we take for perfect science, what we take for the pinnacle of wisdom, isn't all it's cracked up to be, and that there's so much that goes wrong, and so, like you said, lack of humility and this unwillingness to even recognize. I had this great dentist, this biological dentist, who took out my silver filling several years ago, and we had a really great long conversation when I had my consult with him, and he was just talking about how, they're phasing out the silver fillings, but no one's going to come forth one day and say, oh, we're not going to do this anymore. And he said it's because we live in such a litigious society that as soon as you said, hey, we really screwed it up here, we got it wrong, we really shouldn't have been putting mercury in everybody's mouth, we really shouldn't have been injecting all of these kids with all these crazy chemicals. But no one can come forth and say that, because just think about the hammer that would come down on all of the people who are complicit in knowing that these things were causing harm. But it's like, we can't backtrack now because we've made it mandatory, or we've done all of this, we've built this whole huge structure around this ideology. We can't just have it crumble, and so we keep trying to support it, and the people who are seeing through it, they see it for what a farce it is, and they don't want to have anything to do with it anymore, and they're looking elsewhere, to alternative practitioners and new ways of understanding their health, because they're like, I've seen this enough to know something's not working. And that's kind of the whole thing. If you look at the numbers, if the science is better than ever before, and we've got all of these doctors and all of this money that goes into research, we should be the healthiest we've ever been in the history of humanity. We should be the healthiest country in the world. Why are we so sick? And when you just look at those numbers and you just start asking those questions, you say, what are we doing? What are most people doing? Why aren't we healthy? You'll see that the pillars upon which we have built our faith and our trust and our confidence in medicine, something's not right there. They are missing big parts of the story. And so many people, thankfully, have woken up to that.
Pretty much. And it's more and more happening all the time, thanks to this internet and the free exchange of information and ideas. And that would just, just make mention, anyone out there, if you have the electron micrograph of the pure and fully characterized virus, the paper that shows that, please go ahead and leave it as a comment for this video. Go ahead and send it to either me or Melissa. I would say the same thing for the primary specialist peer-reviewed paper, which basically has the virus illustrated and its full genetic information described. I find that that's not there either. Or certainly Koch's postulate, ever proven that this actually shows that it causes the disease. It's a dangerous world out there to presume that, I'm going to use the pronoun they, who have set up these systems, as you mentioned, the dental and medical systems that seem to be verified to damage so many people, that they are set up like that to quietly move in a certain direction away from where they can't be attacked legally. They're, everything from the vaccine court that protects vaccine manufacturers and the doctors who administer them from any repercussions. And I believe at this date has paid out to the tune of more than $64 billion to a small percentage of the people who actually were damaged by vaccines. And that's a small percentage. We cover testing and treatment. The final T is trading one illness for another. And so that's basically similar to what you were saying before around, say, an incinerator that goes up, that's obviously going to be causing toxic damage to residents in an area. And then, for example, a whole bunch of, I would say, highly faulty PCR tests being used to verify that those people are infected. That's trading one illness for another, like that. Have you seen any signs of that happening in general?
Well, I guess you go in for one thing and then you develop all sorts of other complications. So you have, one conflict that induces tissue adaptations, and then you go in for someone to allegedly fix you, and we often develop additional conflicts, or we have other reactions to things like medications, like we talked about. And so, and that's where returning to nature and understanding your body, understanding how does the body actually get sick. If it's not consistent across the board, that is bacteria and viruses, like what is it? And so that's where, for my work and understanding the 5 biological laws, I find it so important for every individual to begin to develop an understanding of their biological self, of how their perception, of how their experience is informing their nervous system about the safety or danger of their environment, and how that they, by altering their perception, by changing the messages that they send to their body, can start sending new messages and start getting new and different results. And so it all has to do with you, your perception, your state of mind, your sense of well-being, and everything that you can do to amplify that and tune in and tap into that and understand when you develop symptoms. Like when I get sick, when I have like, actually this is a funny thing, an example, I had like a little like acne breakout over here. And from the German new medicine perspective, that has to do with the feeling attacked or feeling soiled. And I was like, okay, in the last few days, how did I feel attacked or feel soiled in this area of my face? And it was because to go grocery shopping, even to just go into the grocery store, I had to have like a scarf wrapped around my mouth. And I remember I was breathing and I'm like, I was breathing recycled air, and like, it was humid and gross and it just felt soiled. I'm like, I don't want to be breathing air from behind this scarf. And lo and behold, a couple of days later, because in that moment I felt soiled from like breathing in this recycled air, and then I had a breakout. And so every time I have a symptom, I view it through the lens of the 5 biological laws. I don't think like, bacteria must have got on my skin like I used to think. Now I understand it from this different perspective. And so, when you are having illnesses and you're like, one illness, I'm trading one illness for another. I've got one thing and now I've got another thing. It's kind of like, hold the phone, go back to the drawing board, see if you can zoom out and figure out what caused this to develop. Because when you understand the cause, you'll understand the cure. And the cure, as always, it has everything to do with self-knowledge, self-awareness, what's going on with you and your recognition of this whole entire process. And I believe that every person has the capacity to understand that.
I agree. I mean, there's pretty simple because we're on the same page with all of this. It's been going on for a long time for me. Long enough, though. I think that the trading one illness for another is easily done when it's done bureaucratically. When the doctor can innocently just put a stat down that they tested positive, and then, but they actually died of, say, a heart attack or other types of, actual, big deal kinds of things, or even injuries. And then the bureaucrats, in order to get funding for wherever their district is, essentially, can then go ahead and put that on the stat as died of the infection. And then that, of course, gets propounded. I think that it has all the hallmarks of being a completely manufactured crisis that has made trillions of dollars, as far as I can tell, because from all the billionaires who stepped down from being CEO right in time, right before this happened. That means, when a CEO steps down, they're allowed to divest the majority of their stock holdings, the ones that were actually going to go down, for example. So they were actually able to really profit on this. Somehow they knew to step down just then, and they knew also to profit really well at this time to basically make billions, each of them, which of course adds up to trillions if you add in all the various other economic functions, hedge funds, all the put options and everything like that was done, the shorting of the market right at the top of the market in March. And that's enough for me to say, okay, that sounds fishy. Sounds like people knew ahead of time that this was going to happen. And I think it's a really good time to leave it on a positive note for people, because for myself, I don't like to divide myself from people. That's the old Daryl that I'm trying to step away from. I am aiming to create a connection in general to make more of an empowered situation for myself and others. And for those who wear masks, I don't want to make a claim that they're wrong for being like in their perspective and in their chosen action. For those, I have my friends who quarantine themselves, and I haven't been able to hug them for a while. I have my friends who hug, and they don't buy into this kind of thing. I've got that, and there's the stores that I could go into without a mask, which is most of them, thankfully, and then the places that require a mask. And here's the tip: once you're in the store and no one's really going to be looking or stopping you, I move the mask down so I breathe out of my nose, and I'm not breathing recycled air any longer. And problem solved as far as my own acne situation. Uh, or other types of, things going on like that. But I ask for a lot of patience to really connect with people in their wherever they're at when you want to connect with them, especially when you're paid to, like you and me. But when you want to connect with people, because again, your emotional salary might depend upon you connecting to certain people. To if I want more humility with people, I would wish to demonstrate humility with my agnosticism around the germ theory and terrain theory, to say I don't know because I don't have Star Trek equipment. I don't have even electron microscopy here. I just am saying, so far as I can tell, the bet that I'm going to place is pathogens, by and large, are likely a non-issue and possibly a minor issue, in general. And that for the most part, the situation is caused by these various metabolic problems. Real toxins seem to really exist. Real toxic components really do exist out there. I'm talking about heavy metals and certain chemicals. And real nutritional deficiencies happen to seemingly exist, like that really does happen. But by and large, like I find that the Germanic new medicine is incredibly is pretty uplifting stuff to just jump into. I'm glad you brought it to my attention because I had never heard of it before I found you. And I've certainly covered the mental emotional landscape plenty in my own work. So I'm looking forward to that. Do you have any more that you want to say? Anything at all around COVID and how to help move forward with this?
Yeah, I think that, developing this greater understanding, getting more curious, if you are being driven a lot by fear right now, if the reason that you're doing all of this stuff is because you're afraid, seek to understand, when you illuminate that fear and you say, what is this really about? What am I really afraid of? Is there really something to be afraid of? And when you look into that, you can still follow the guidelines, you can still follow the rules, but it's the spirit from which you're coming. Are you coming from a place of fear? Because if you're in fear, your body is responding to that fear, and keeping that in mind. And so exploring new avenues, opening up your mind to new understandings of the universe in which you find yourself, and finding out what these crazy people are saying. Like, what is it for you that takes you from, oh, they're all just crazy, to maybe there's something to this. Maybe there's something for me to discover here. And it's all a journey of self-exploration. And it's all a journey of getting to know, what makes you tick, what scares you, what do you find most compelling, what are you most inclined to believe? Are you inclined to believe everything just because it's on the news? Do you just assume that everyone's doing their due diligence and that you are getting accurate information? Or do you feel like you need to discover and learn things for yourself? And so I think that just basing it on yourself, like you here right now, are you afraid, or are you feeling at peace and confident in the direction and in your understanding of what's going on? And so, and if not, seek to find that information. Like, that is the cool thing, is like we have connection to more information than anyone ever before in history. But unfortunately, a lot of times we use it to freak ourselves out and to watch things that make us panic even more. But there is information, there are ways that you could be understanding yourself in the world that could bring you such immense peace. And I invite you to kind of like go explore those realms and explore understanding your own body. Because when a certain subset of people have all of the answers, and they have all, and you have to go to them to get all of your cures, it's like this intermediary. It's instead of going to confession, you can go straight to God. You can go straight to understanding your own body. And don't underestimate your intelligence, and I think even part of the whole kind of medical system is like shrouding the knowledge in Latin and these complicated words. And a lot of people think, oh, well, I could never understand. Oh, little old me, I can't understand medicine. I'll leave it to the professionals. But the thing is you are a human, you are in a body. It is up to you to understand that body and understand how it operates. And so I do invite you to check out Germany Medicine 101 on YouTube, because it'll give you just the big picture overview of everything about the 5 biological laws. And you don't have to take it as truth just because you watched it. I don't ask people to kind of wholesale take on my beliefs, believe what I believe. It's all about you understanding. See if you can make sense out of it. See if you can observe these biological laws in your own life. See if there's something to it instead of just throwing it out because one thing you don't agree with, or because you weren't taught this from someone in the mainstream. And it's, again, how do you relate to information? This is going to be a growth period for every single person, and it could be something that allows you to become the best version of yourself, or it could make you crumble. And so I hope that you use this and utilize this very unusual time that you're at home and can't go out anywhere, to study, to research, to utilize the internet for its benefits, and to come out of this stronger, more confident, more healthy than ever before.
Melissa, how can people out there find you so they can go ahead and get one of those 15-minute free consultations or start to work with you?
Yeah, you can check out my website. It's drmelissasell.com, drmelissasell.com. So yeah, and I've got free 15-minute consultations. I've got a lot of different courses. My YouTube channel has a ton of free resources and material if you just kind of want to start there, and then reach out if you have questions.
That's awesome. Thank you so much. And I look forward to next time.
Thanks for having me.